The Institute of Medicine has labeled emergency departments as the safety net of the safety net. Emergency departments are the provider of last resort for millions of patients who are uninsured or lack adequate access to care from community providers. HIV disproportionately affects populations that are likely to be without a regular source of health care or have a history of barriers to access care, which may contribute to delayed diagnosis and further transmission of HIV. It is estimated that 45% of HIV-infected persons have no health insurance, 30% receive coverage through Medicaid, and 2% have Medicare. Consequently, EDs, whose patients include large numbers of underinsured and uninsured, are likely the only source of health care for many people with HIV or at risk for HIV. Routine HIV testing in EDs increases the chance of identifying these individuals and referring them into care.
It is very important for opt-out testing to be done in the emergency department setting, again, because this may be the one time that they come into contact with the healthcare system for many, many years. And if they do happen to be one that screens positive and we have caught it early, then they can get all the needed help.
When you talk with the physicians now in the emergency medicine community, I think you see that there is a bigger understanding of the idea that you need to be testing for this regularly and that it can provide useful information about what you're going to do in treatment right away instead of waiting and just thinking that it's something that can be dealt with later.
The best way to perform the testing and deliver results is the way that fits in with your practice.
When we initially began this project, we planned on doing point-of-care testing, just the oral quick swabs right there in the emergency room, and having our stat lab do the reading. That turned out to be incredibly overwhelming to our stat lab, and our plan B was standard routine testing, but to batch it so that we were running it multiple times throughout the day where we were getting a quick result. And that has just proven to be incredible for us.
I think having also a secondary structure of somebody, a follow-up structure, somebody who's going to be following up all the results. Emergency physicians are very busy in trying to get them to do an extra step of just, the whole counseling and setting up all their follow-ups at that time is really hard. So having a system that picks up all that kind of, all those processes are very important.
The ED may be the only healthcare environment many of the patients use. So the ED might be the only place to potentially catch a positive HIV case. The emergency room is a high-volume, fast-paced environment, so an important issue is choosing the right testing method and procedure. Have specific resources dedicated to follow-up, because ED personnel don't have the time to do follow-up.
Well, it's really to try and use the word routine as pronounced as possible in the presentation to the client.
We consider this a routine test and that we're giving everybody this test.
This is just part of what we do on a routine basis here for every patient that comes through the door.
It's just like getting your cholesterol screened or looking at your blood pressure, all your vital signs. We want to make sure HIV is included with that conversation, so it makes it very normal.
It's a matter of changing the culture within our staff, normalizing it for people, having them be comfortable with asking it.
One thing that I learned early on is the benefit of having a champion. Dr. Skelson Hojai is our champion at Ben Taub. We collaborated on the entire thing, but when we'd meet an obstacle, and we had a few, he would always help us solve that problem, keep it simple.
It has to be in an automatic system. The order is already on the order sheet that's used. It doesn't have to be added to an order. It's already ordered on anyone we're drawing blood on.
Many people are concerned that they don't have the training to do HIV testing or to do the counseling that's associated with it. But we'll be clear about this. There's no special training that's required to do the HIV testing or deliver the results.
The nurses would forget to draw the extra red top. So we put reminders on the nurse's cart. We put reminders at every station where they drew blood to rush that red top, and did you get the extra red top, and all those kind of things, and made it catchy. Where the medical community has had some reservations, that there's still a lot of old notions out there as like, well, what do I do with this patient when I tell them they're positive?
It's not different from telling a patient you have cancer.
Giving positive results, I think, is just a matter of treating people as we would want to be treated if we were given that kind of news.
Well, talking to a patient, it's basically you have to put it as simple as possible to them to help them understand what it means to have HIV.
And so we spend the time with the clients that they need. We give them the results, give them some time to think about it, and then just let them talk or ask questions or whatever it is that they need to do.